Hey, good morning, everybody. Really happy to have you all here joining us, and we have this incredible panel of women that are excited to talk to you a little bit more about their experience today. So I'll very quickly introduce myself, Meagan Howard, happy to be here. I work with TMC Innovation and have had the pleasure of working with most of this panel, which has been a really pivotal piece of my career and my own development. So I'm excited for you all to hear from them. But with that, we're going to turn it over to the stars of the show, and I'll quickly do an introduction, and we'll go from there. So right next to me, I have Michelle Stansbury. She is the Vice President of Innovation and Information Technology Applications at Houston Methodist. She started at Houston Methodist in 1993 and has grown her career there, notably being an integral foundational member to the Center for Innovation in 2018. Thanks for being here. Next, we have Ayse McCracken. She's the founder and board chair of Ignite Healthcare Network, which brings together dynamic women executives interested in shaping the future of healthcare. Ayse previously served as a senior executive in some of the country's most prominent healthcare systems and uses that experience to serve as a business advisor through Innovate Health Ventures. Next, we have Sam Lewis, and she is a principal at Mercury Fund, where she's responsible for sourcing new early-stage investments. Previously, she was the investment director for Goose Capital, which was a private investment firm investing in early-stage venture capital deals. So all varying experiences, but very impressive women. So with that, we'll jump into some questions. And Michelle, I think you're first up.
All right.
So for you, we wanted to talk a little bit about your career. You started in hospital IT. And can you talk a little bit about what made you choose that path initially and what you've seen change and how your career has developed over the last 28 years with Houston Methodist?
Sure. I mean, first of all, I will say it's sometimes hard for me to believe that it's been that long that I've been in healthcare. But it didn't start off there. I'm a traditional Texan, started off in oil and gas, like probably most people do, you know, back in the day. But quickly got very intrigued with technology, so went to a company of, most of you might have heard, Compaq Computers, that is no longer in existence. But 29 years ago, had my very first child, and he ended up having some issues. Had to be transported down to Texas Children's and was in the neonatal ICU. And after that initial shock got over, my husband and I both were like, wow. We just couldn't believe, and we're so very impressed with the care and the things that were going on within that hospital, that we just felt this greater purpose that we wanted to get into a field where we were purpose-driven. We were making a huge difference. Now, I didn't go back to med school, I didn't go back to become a nurse, but with my technology background, and I had a background in finance as well, I went to Houston Methodist. And so, you know, I would just tell you, I came from a technology company and got into healthcare. The one thing that I very first noticed was technology really wasn't prevalent within healthcare during that time frame. We were already doing email and everything else at the technology company. When I came into Houston Methodist, they were still handwriting notes everywhere. So, you know, I would just say that kind of what I've seen morphed. I've been extremely blessed to be at Houston Methodist. Had so many great opportunities, been able to see that institution grow and really embrace overall how it is that we can take care of our patients and the community around us. And, you know, with the innovation side, and I appreciate, you know, Roberta was on that last panel, but where I see myself, and the reason that I'm just so passionate is what more can we be doing for our community and making it easier for them to get the health care that they need. And I use examples from myself. And I'll just tell you one here recently. Every time that I do have to have some sort of healthcare procedure, whatever, I kind of step back out of being an employee and I become a patient. And I really look, what is going on here? What's working well, what's not working well? So that I can take that back to end up making some positive changes in our organization for the next patients that do come in. But very blessed to be in healthcare and can't imagine you all as the up and coming stars here on, you know, what it's going to be like for us in the next couple of years.
Well, and speaking of up and coming stars in the room, Ayse, you founded Ignite in 2016 with the intention of taking women that are looking to change the future of healthcare and supporting them through their journeys. Can you talk about what inspired you to make that switch in 2016 to start Ignite and start working in a different capacity than you had previously?
Yeah, so I've had a long career in healthcare. I have had the good fortune. I started downtown working for Arthur Andersen. So much like Michelle, my work was in oil field services, but dabbled in healthcare. And that started the trajectory and the path down into working, healthcare finance work. I worked for Arthur Andersen and for Price Waterhouse, and then worked for Texas Children's, Houston Methodist, and Memorial Hermann. So I kind of worked my way down Fannin. I'd tell you that one of the things that was fascinating in that career journey is all the smart and incredible people I had the good fortune to work with. And so in 2016, I had started working with startups. I had gone back to McCombs in 2010. I was school mom and did the executive MBA program and felt that in order to continue to improve healthcare, technology had to play a bigger role. Throughout my time as an operator in healthcare organizations and large organizations, we were consolidating. And when you put things together, they don't all sort of neatly match, right? And there were new technologies coming in. And so the IT struggles were very real. They had so many different platforms and applications. And so I was curious. And 2 years after McCombs, I started to focus on digital health and data, which then went to med devices. So in 2016, I was thinking of all the incredible women I had met on that career journey and had 3 other friends, colleagues, and we said, well, let's just throw a party. So we made a list of 67 incredible women who were all in C-suite roles in a variety of different sort of backgrounds, right? People working in health systems, people working in payer organizations, people who worked in technology, venture-backed companies, bankers, PR. Everyone touched healthcare in some meaningful way. They had influence in telling a healthcare story, in running a healthcare business. 67 invites went out, 45 women showed up, and my husband left. Way too many estrogen, too much estrogen in the room. And he did come back. But it was an incredible event. And it was meant to be just a way to bring us all together. But the energy, the intellect, and the stories afterwards made it evident that there was a reason we had this level of energy, and there was an opportunity to continue that conversation. So we quickly formed a steering committee, incredible women that became a part of that steering committee, Roberta Schwartz being one of them, and several others. And so it was originally meant to just kind of help each other along, give each other a hand up. But we got intrigued by Shark Tank, and TMC Innovation had started. And we thought, if we're going to make a difference here, maybe we do something that focuses on female entrepreneurs. And so that's how we started a pitch competition. 2 years of a pitch competition, and Roberta said, pitches are not enough. You hear somebody who is very charismatic, who can sell you a concept, but the concept isn't fleshed out enough. Can we do this a little differently? I want to look under the hood. So year 3, 2019, we started an accelerator. Along the way, we're bringing women together, but we're doing the research and realizing, which this, 80% of healthcare purchase decisions are made by females. 70 to 80%, depends on where you look, of the workforce is female. 13% of the CEOs are female. When you look at gender gaps, there's a huge gender gap in healthcare and an opportunity to elevate women and amplify women's voices as healthcare changes. So if we're the ones taking care of our families, taking care of our aging parents, and working in the industry, we're not only the purchasers, but we also know something about this. So why aren't we finding solutions from women who are working in the trenches and really can provide some meaningful, novel ideas, right? So we started an accelerator, had partners throughout the TMC who would take in our startups, applicants. And by virtue of who they took in, we could tell what kind of solutions they were interested in. So we had 14 applicants that got adopted. Michelle's been a part of this program since its inception. Actually, so has Meagan. And 14 of them started, 7 or 8 of them scored highest and ended up at TMC pitching. Investors got interested. We raised $434,000 for 6 startups that year. And we're like, we've got a formula that works. We're going to do this again in 2020. By the way, in 2019, one of our investors had an award called the Corona Award, which was a little interesting when you look back on it. But in any case, what we did in 2019 didn't work in the same way. So we pivoted to a virtual platform. And we've never done anything like this before. My partner in doing all of this is a nurse, a longtime colleague from Texas Children's, Cheryl Stavins. So we said, okay, we're going to make this work. We took on the Ignite Madness after March Madness and had a great result. Raised over $700,000 that year. We had 34 applicants in our cohort. And by the way, Zoom took down all our barriers. So now we have partners coast to coast. And we have relationships with Startup Central in Israel, with the consulates in Denmark, UK, where else? Australia. And we get companies from all over the world. This last year, we had 270 companies that applied, and 32 in our cohort. And if you're not busy tonight, come hear the finalists that are pitching. And we have $775,000 in awards this year. So we've clearly found a niche, and they're women who are doing great work. VCs love what we're doing because we are bringing companies and ideas to them that have been vetted. They've been through a curation process. And so they still do their own due diligence. It's not like they're going to write a check, but we're at least doing some of the homework and bringing them companies that don't come through the typical VC channels, right? 97% of VCs are guys, so it's great to have Samantha on the VC side. So that's part of the work that Ignite does. We do a lot more to amplify the voices of women and to inspire more women to come into healthcare. We partner with academic institutions. We just supported the U of H hackathon and had their finalists pitch last night at our VIP event. So, you know, it's great to see interest in this field, and we love to see women succeed and bring their ideas to the forefront.
Yeah, well, and it's interesting that you mentioned how there's a lack of women in the VC space, because we have Sam that can speak to that a little bit. It's funny, but it also seems like that reflects on the entrepreneurial side as well, right? So the experience for a female entrepreneur is different. Can you speak a little bit to your experience as a female VC in a world that's dominated by men mostly? I mean, the statistic was
93% of VCs are male.
So can you speak a little bit to that experience, which is pretty unique?
Yeah, of course. So I will give y'all a little bit of an intro too, but first let me start with a data point that I think is really important. And so it goes back to what we're talking about here. And it's the data is out from Women in VC. They published it, a group called Women in VC, they published it in 2020. And now it's really starting to be widely accepted in the industry that the more diverse check writers you have, the more diverse portfolio companies you have. There's a direct correlation there. And so VCs are now having actionable data to be able to act on. And so you're starting to see more and more women getting hired into VC firms, and not just women, this goes across the board for people of color and other underestimated entrepreneurs as well. And so people are starting to, what sometimes they call build the bench. But now there's a lot of other, that's great. So we have a lot of junior partners and we have a lot of juniors that are coming into VC, but that's not necessarily still check writing. And so it's really making sure that there's that on building the bench internally, but then there's also the other piece of making sure that you're widening the aperture for everything. And that's deal flow. Thank you to you. It's strategic partnerships on who is acquiring the startups and who's becoming successful in those CEO roles as women and much more. So I know that's not the question. So let me get to my intro and then keep me on track. Just pull me back in when I need to. So Samantha Lewis, have been in Houston for a little over a decade now and absolutely love it. Went to business school at Rice, started 2 companies before that, not in the healthcare space, but went to business school at Rice and really wanted to do entrepreneurship and figure out a way to leverage that into VC eventually. And so what I had to do, hi Serafina, the queen right here. I didn't see over there. So what I did when I got to Rice was, okay, well, if I'm going to stay in Houston, which I wanted to do, I was like, I guess I better figure out what healthcare is really outside of me going to the doctors and figure out what energy looks like. And so I really dug into both of them and I was much more drawn to the healthcare side of it. And so fast forward, after business school, I joined an investment group called Goose Capital, renamed actually to Goose Capital. And so what Goose Capital is a group of highly successful entrepreneurs and Fortune 500 CEOs that come together to invest in technologies. They're comfortable being the first check into technologies, and they're comfortable doing things like med device and doing a lot of the investments that often VCs might not take as early of a look at, or that VCs don't want because of certain sales cycles and so forth. So I worked for Goose for 3 years. We did a lot of med device during that time. And so I was really getting up to speed. Thank you. You helped me a lot on that. Getting up to speed on what that looked like. I spent a lot of time over here. And then about a year and a little under a year and a half ago, I joined Mercury Fund. And so I joined Mercury to continue doing what I love doing, which is investing in startups. And a big part of why I joined Mercury is because of what Mercury has been able to build around what we call our diversity stack. And so there's a lot of work that our team had already done there on thinking about how do you diversify every single thing we do? And how do you build inclusion into all, like every decision we make at the firm needs to be with an inclusive mindset. And so they had already done a lot of work. Blair Guru is one of the co-founding managing partners with Dan Watkins, who I just saw walk in. And so Blair had already been doing a lot of that work with some other partners. And what I was able to do when I come in was really just take a look, pop open the hood and be like, okay, now let's add the gender lens to this. And so we went through a lot of open and honest conversations, and this actually goes to the question, but being the only female at partner level in the room, there was a lot of really just open conversations that I had to be open to and that they had to be open to for us to figure out how are we making sure we're best supporting female CEOs? How are we making sure that when we're taking those pitches from more and more females, that we understand the problems that they're solving? Because sometimes that's one of the big problems that I've realized through a lot of the data and research that I've done in the industry is often when it's a lot of male VCs, they don't necessarily understand the problems that sometimes female CEOs are going out to solve. And so there's just having those other perspectives in the room that I think is really important. And so what we've done now at Mercury is we've really built a framework and a system around it to make sure, one, we're holding ourselves accountable, but two, that we continue to question on, okay, why is this problem being solved? And we pull in people as we need to help us continue to ask those questions. So we've identified what we think are some of the reasons women weren't getting a lot of funding, and now we make sure that we actually bake those into our screening and our diligence process so that we're trying to take the least biased look as possible when it comes to underrepresented founders and companies.
Thank you. And I think that experience, it's good for us all. Everybody here is interested in the healthcare innovation space, and we get to benefit from kind of the spectrum of that experience with you all and people that have been successful and are helping other women be successful in that space. So from your all's perspective, and maybe we can just run down the line here a little bit, for all of the people in the room who want to impact this space and want to work in it, is there some general advice, something that you've learned that has been really impactful to your careers and has helped you get to where you're at?
Yeah, I would say probably the most important thing for me is, as a female kind of up and rising in the organization and kind of overall in healthcare, I never saw titles. I saw people. And I think that was a big important distinction for me, because I know sometimes people will get wrapped up in titles and I can't really speak to that person or whatever, but it was important for me to be able to see you as a person, to talk to you as a person about what I believe needs to change. And sometimes that's very hard, because sometimes the people you're talking to about what needs to change are the very people who probably put that change in and they think it's working well. But I'm very passionate about what I do. I'm very passionate about what I do for our patients. And so it's what I would tell any kind of anyone in healthcare, but females in general, that you have to know what you're driven to do and what you're wanting to accomplish, and don't be afraid to do that. You will get told no a lot, but that's okay. Don't let that stop you. You need to just kind of keep trying and keep going. But I've been extremely fortunate in what I've said previously before at Houston Methodist, a lot of great leaders who have been willing to work with me, listen to me, allow me to throw those ideas out there, even though they weren't sometimes accepted. But I think that's just, for me, the most important thing is knowing exactly what you want to change, what you want to do. And don't be afraid. Don't be afraid to keep driving and trying to push that change to evolve as an organization, to do the right thing.
I'm going to build on what Michelle spoke about. And I think when I look back at my career, the idea of continuing to learn and learning from the multiple organizations and cultures that I have had the great fortune of being able to experience, and understanding organizational dynamics and how you can be successful inside various organizations. And to build on the people side, Ignite would not be where it is without the great relationships that were built along the way. And so I think I've learned beside and from so many incredible people over my career working in healthcare, and I continue to do that. I am a student at heart, and it's part of what continues to drive me is I want to learn and I want to have an impact on the way that healthcare is delivered, and that the people that work in healthcare as well. I'll go back to this is my 41st year in healthcare. I started when I was 12. Candy striper. But it's complicated. And the people that work in healthcare are very passionate about what they do. And how do we take care of patients and deliver the kind of care that you hear Michelle talk about, and what people in the industry want to be able to do, and yet, especially today, the complexities that they're dealing with and the issues for the clinicians and the staff become more and more evident and higher priority around how we can deliver care and improve their lives as well. So, when I look at learning and understanding what are the priorities and how do we take care of patients, but also enable the teams that are doing that work, those are parts of understanding the industry, understanding the culture, learning, because in the 40 years that I've been in this industry, it's never been the same. There are always things that continue to present new challenges, and from unexpected places. Who would have anticipated COVID, right? So keeping your eyes wide open, making great relationships, understanding the nature of problems, and working with folks to help make an impact. solve problems in a meaningful way.
Okay, so I actually wrote mine down because I recently did take some time at the beginning of the year to really write down what it means for me to, really try to drive change and what I'm committed to for 2022. So I've actually not shared them publicly, but I remembered I wrote them down and I was like, oh, let me go find these for this panel. And so some of the things that I am committed to, which I have decided is a good framework through which I can help other underestimated entrepreneurs and other VCs, and in general, myself, my career, and my firm, Mercury. One of them is to arm myself with data and then use that data in a way to help educate others. Because typically when we find there is a lot of bias in this world, and some of it's implicit, some of it's explicit, but typically, maybe I choose to believe, but I also think it's true, that it's usually not done out of malice. And so there's usually just a lack of understanding. And people, in my experience, have always been willing to learn. So sit down and ask me what it's like being a female VC, right? And what it's like, okay, being the only female in the room over and over and over and over and over again. And so they want to know. And then I can turn around and ask them what it's like in other types of situations. And I can do that not just, again, for females, but for all underestimated entrepreneurs and other VCs. So the way that I have decided to use data was to, one, educate, but also start creating a personal kind of public brand around that. And so during COVID, because we were all just sitting at home and I didn't really have anything else to do, I was researching this a lot and I launched a Medium page. And so the Medium page was supposed to be about my investment themes and where I really want to invest. And then what I ended up writing about for a year, there was nothing about my investment themes on there. And it was really all about the implicit bias that I was finding and experiencing in the industry and that others were experiencing in the industry, and then how to combat that. And so now I can always go back. That's just helped me on my quest for data and using data to arm myself to help us all like widen our lens when it comes to breaking down some of the biases that we have. So that's one. Two, I think is really, really important is finding sponsors within the organizations, sponsors and support structures. And so internally at my firm, I have a very, very supportive partnership that I can go to and talk to about, hey, what did I do in this situation, or what can I do in this situation when I might have not felt comfortable saying this, but there was some real bias that I was experiencing here or that I saw experiencing. And like we can have open conversations about that because they start to pick up on it too. And it's really great. And the reason we got there is because we can have those conversations, because I've shown them data before, because they've also tried to find data. But then they're also just very supportive people. And so I think being able to find that, if you're an entrepreneur and you're going out to raise money, you're taking money from VCs, and that's a really serious commitment to have those people on your cap table. And so also doing that within those VC firms, who is going to support you when you're not in the room? I think that's really important. The open, honest, and tough conversations, which I've already mentioned, that's absolutely key to me. And that's how I've been able to really, I think, drive as much change as I can, and also be very comfortable with some of the vulnerabilities that I experience being the only woman in the room. And then finally, this just happened about last year. One of my mentors, Sandy, with HX Venture Fund, really helped me get here. And she's like, you need to lean in to being a change agent. And I know that's kind of a buzzy word, but it's absolutely true. And so when I was sometimes getting a little frustrated from what I was seeing industry-wide, I was getting down about it. And then she helped me realize that instead of getting down about it, whenever you are experiencing these biases, or you are experiencing really just some, So when you are experiencing some of these things, it's like, what can you do? And what you really can do is just really lean into the fact that we are in a position to be able to help educate people and to really be able to make change. And so how do we do that? Everyone, it's going to be different for every single one of us. But leaning into that instead of just getting down by it seems obvious, but it was something I needed to hear at the time. And it's really helped me to be able to have more and more conversations with people about it as we go. And I think those conversations are key. So that's what I'm committed to.
Thank you. Okay, great. Love to take some questions from the group. I know that we cover some broad topics. Would love to dig in a little bit deeper with anything that might be useful.
What do you guys see as the biggest impediments to female entrepreneurs in healthcare?
What's holding them back? If anything.
Well, and it's probably Ayse would be really good, and even Sam on this. But just speaking from healthcare and working in a healthcare institution, I think it's our own internal self. To be honest with you, I think that is where I kind of said before, you have to have that drive and passion, and kind of building on what Sam had said of being an influencer. And how do you do that? By building relationships. So it's kind of all just encompassing of it. But I think sometimes in ourself, you have that self-doubt, and you've got to really put that behind you, and really just be passionate about the change that you're trying to make, and drive forward. But I would just say it's our own internal self.
Yeah, I would call that creative confidence, a lack of creative confidence in some level, right? So what we try to do is give examples of women who are out there, committed to being a change agent, as Sam describes. But the other piece of this is so interesting. Now, we have 7 startup founders with us. They're the finalists from Ignite's last accelerator program. Yesterday at lunch, I'm listening to these young women who are so committed to their ideas. 2 of them have sold their homes to be able to support their businesses, right? So the level of commitment and risk-taking is really pretty incredible. And the third piece of that is capital. So it's hard for women to get access to capital. So while, if it's all female, it's an all-female team, less than 2% of the VC dollars go to all female teams. Mixed female teams are now up to 15%. And if you look at, ethnicity around there, it gets even more dicey. So yet the confidence is one aspect. The level of risk is another on multiple fronts. We want to take some of that out. When you see more VCs coming into, providing access to capital, it's going to give more fuel to women who will then take the level of risk, but maybe you don't have to sell your house, So I'd say it's those, sort of three things, yeah.
So I'm just going to flip this on its head and say something a little different, because I do believe that there is so much internally that can hold people back, but oftentimes that comes from societal bias and societal structures that are existing. And so that's where I've spent a lot of my time really trying to understand what those are. And trying to understand what are actionable things that we can do day to day to start breaking some of those down. So imposter syndrome is absolutely real. I think everybody feels it, including my male counterparts. At least a bunch of my male friends on Twitter talk about it, but maybe that's just for likes, I'm not sure. But I think everybody, I think people really do experience the imposter syndrome. But understanding that everyone feels that, or everyone has experienced that before, then it's really flipping it on its head and not really asking the question, what holds females back as entrepreneurs, like themselves, but really what structures and systematic barriers are in place that are holding people back from being able to raise the venture capital funding. You covered that, so I don't need to hit that anymore. But it's also more, it's navigating boardrooms. Because if you're a CEO of a company, you have to figure out how to manage a board. You have to figure out how to talk to investors and continue to update your stakeholders while you're also building customer traction, and while you're also talking to the CEO of Memorial Hermann. And so you really have to be able to navigate a lot of situations that there is a lot of implicit bias baked in. And so it's really understanding, hey, when I recognize that bias, what are some tools that I have that I can get around that? Or are there other people in the room who could be my sponsors there?
Do you have time for one more? One here?
This speaks to what you just said, Samantha. This obviously plays to the audience a little bit. How can males be better allies to help women in VC?
Good question.
Should I go first?
Sure.
Go ahead.
Okay. So I think there's a lot of different ways, and I think it's really just, thank you for asking that, by the way, and hi, miss you. And so I think there's a lot of different ways that I found that males have been allies to me. And so it's really in a way that feels like true and authentic to each person. And so sometimes it's just sitting there and asking like, hey, what are you experiencing? Hey, you were the only female last night in that room. I recognized some things were being said. I'm sorry, that you can't really like speak out in those things. What can I do next time to kind of like steer the conversation away? So then there's those day-to-day things like that. But ultimately, if there's one thing that I think everyone really can do, it's just, again, how I'm telling us to arm ourselves with data so that we can talk to people about it. It's really the men that are taking up most of the C-suite roles and are making the decisions for check writing to understand implicit bias and question your own bias, because it's there. We all have biases. And so it's really understanding what each one of ours is. And then it's understanding when that comes into play and how we start to break those down. And so I think that that's key for leaders, especially people in leadership positions who are trying to be allies, and whether that's for gender or for racial and ethnic founders and VCs.
So, can I add? Yes, please. Okay. There's a book called Invisible Woman, and it is about the lack of data on women in many different sectors, right? So this systemic issue is a really interesting conversation. And if you're interested in learning more about it, the book's available on Amazon, and it's just eye-opening. So I think it's very real. The fact that all of you are in this room listening to this conversation, I think is great. For Ignite, we don't put our work on an island of just women, right? So for guys to be involved in the conversation, I think and taking interest and asking the kind of questions you just asked is a great step.
Yeah, absolutely. Actually, I have one more thing to add. This is actionable. So I love Instagram and I love Twitter. So this is where I spend a lot of my social media time. And so whatever your social media platforms are, there are a lot of influencer accounts on those that help to educate, and they're focused on a lot of different types of areas. And so I follow a lot of those on Instagram and on Twitter, which helps me. I've started to read your book. I haven't gotten through it yet. And then there's a super simple one. So cutting things from your language. So if a woman is getting worked up in a meeting, don't say, oh, she's emotional. Because automatically people assume you're more emotional because you're a woman, but if a man does it, it's like he's passionate, And so knowing what those are, there's some really simple low-hanging fruit to remove from your vocabulary. Don't call a woman crazy, don't call a woman emotional. So just some of the very obvious things, or I guess obvious maybe to me sitting here, but those that have really driven a lot of the bias and the implicit bias that is still present, I'd say work on striking those from your vocabulary immediately.
Yeah, if I could just say, look, I've been in healthcare 29 years. I was at, compact computers before in oil and gas, so I'm not going to give away my age. But yeah, I started it too, working. Let's just take it back to oil and gas. I mean, if you want to talk about a male-dominated world and trying to move up, I've seen it, I've lived it. Was extremely fortunate coming into Houston Methodist, where, as I told you, I kind of started this out, right? Self-doubt, being very driven and passionate, not seeing titles, not seeing male, female. I'm here, I'm a human just like you are, and I am trying to drive change in this organization and not afraid to speak up and say those things. So, is it still here? Yes, not what it was way back when, I will tell you that. And so I think as we just continue to evolve and really look at each other, not as male, female, black, white, whatever, we're all humans. And, we're all just trying to work together to better ourselves and our communities and things that we're doing. That's what I would say is the change, not trying to look at everyone as being one or the other. And it's getting there, but we're not there completely yet.
Thank you.
I was actually thinking that when you two were giving your intros, I was like, wow, I can't imagine what you had to go through to get here, but thank you for laying the groundwork.
Well, and it made a good point. Everybody being here is a really exciting thing. I know I got a lot out of today's conversation, as I continue to get out of all of you, so thank you personally. And then thank you to everybody who joined us today. Really good to have you here, and we're happy that you joined us.
Thank you.